Good evening viewers, this is Marina Francis with you. Welcome to BMC Global Live Al-HILAL Health World, nothing but lifestyle. The journey of motherhood is definitely a beautiful one, but it is also a very much challenging one. On embarking on the journey of motherhood, there can be many queries that can come to a person's mind. So in today's episode of Health World, we are taking up the topic, the first trimester, do's and don'ts. So before we move on to the topic, I'm happy to welcome once again to Health World, Dr. Jasmine Sankaranarayanan. She is a specialist gynecologist with over 10 years experience in the field. She has completed her MBBS, DGO and DNB from the Calicut Medical College and has also worked there for many years. Currently, she is working at Alhilal Hospital, Mohrak. So let's move ahead with the discussion in today's episode. Good evening, doctor.
Thank you once again.
Yes,
your studio
doctor.
has become my second home.
Yes, definitely. Anyways, doctor, we are up again with yet another topic today, the first trimester. So before moving on to the topic, how do we calculate the age of pregnancy?
For a couple, it is a moment of joy, to see those two magical lines on the urine pregnancy test kit. But along with that, it's a feeling of realization. The realization comes of added responsibility towards the unborn baby, and they get overtly anxious about knowing how old the baby is and how to calculate the gestational age. So what we should basically know is the pregnancy period is divided into 3 trimesters, and the first trimester will extend up to the first 13 weeks of pregnancy.
Okay.
So remember that always the gestational age of the baby should be, or the age of pregnancy, that's what we call it as the gestational age. It should be calculated from the first day of the last menstrual period.
Okay.
And this is applicable especially for women with very regular cycles. There are ladies who have their periods, their menstrual cycles extending up to 3 to 4 months. That means they have irregular cycles. So for them, this may not hold strong enough because they don't know when their last menstrual period exactly was, or they may not be even checking it because it's coming only every 2-3 months. So for such women, what they can do is, as soon as the pregnancy test turns positive, they have to visit their gynae. Their gynae will examine them and also ask for ultrasound. That is, a scan needs to be done. This scan is also called the dating scan. It's the early pregnancy scan. So it's called the dating scan because depending on the growth of the baby, we can calculate the gestational age of the pregnancy and also the date of delivery. That's why it's very, very important to have this early scan, especially in women who are not sure about their periods.
Okay. Doctor, we have taken the first trimester for discussion today. So are there any risks associated with this first trimester?
If you ask me if it is risky, then yes and no. That would be my answer. Why I say no is because at least half of, if you are noticing, at least half of the first trimester is going unnoticed that you are pregnant. By the time you know you are pregnant after checking the pregnancy test kit, at least you have crossed the first 1 to 1.5 months of pregnancy, right? Yes. And because we are totally unaware of that fact that you are pregnant, you go about doing everything in the routine way. You must have exercised, you must have cycled, you must have run around here and there. All these things are happening, and only after 1.5 months you get to know that you are pregnant, isn't it? That's why that way our uterus is destined, it's programmed in a way that it can hold the pregnancy strongly. Okay, unless there are some other reasons for it to go in for a miscarriage. So why we would say it is risky is that because this period, many of us are unaware that we are pregnant. Many ladies go ahead consuming unsupervised medications, over-the-counter drugs. Okay, drugs in the sense medicines. Any kind of medicine is considered to be totally unsafe for the baby. So that's why this one period can be very, very harmful for the baby if the mother has consumed some kind of dangerous medicines. And this could result in serious birth defects and abortions. That is why this one thing has to be properly looked into before carrying on a pregnancy.
Okay. Doctor, so then how can such risks be prevented?
First and foremost thing I would advise all the couples is that they should plan a pregnancy. It should never happen that they come to our clinic saying that we are not yet ready for the pregnancy, doctor. We have this responsibility, we have these issues. It should never happen that way. There are a lot of contraceptive methods you can use, you can adopt to prevent a pregnancy unless you are totally ready. So once you have decided, as a couple you have decided that yes, I want a baby, that is when you have to first go and visit a gynae. To the gynae will ask you certain questions to elicit your medical history. She will try to find out, you have to be as open to her as possible so that she can know about any kind of medical problems you have. If you are suffering from any kind of chronic medical condition like diabetes, hypertension, epilepsy, heart disease, it could be anything. Whatever it is, and if you are on some treatment for that, you may need to change over to more safer medicines that could be less harmful to the baby. And yes, of course, we have these options. So that is why it's very important to let your doctor know about that. That is one thing. Then another thing is getting a family history. The doctor will definitely ask for any kind of genetic diseases that are running in your family. So there is a possibility that if you have some hereditary disorders in the family, that could pass on to your baby also. So the necessary tests, the necessary counseling, all this will be required in that situation.
Okay.
Moreover, if you are totally free of any health issues, still she will examine you, she will look for any pelvic infections, give you the treatment for that. Alongside, she will also suggest some blood tests to be done. Especially, I would say that all women who are planning a pregnancy should definitely go and get a blood sugar test done and a thyroid test done. Because diabetes and thyroid disorders, these are two very big problems that are very common but less treated, and that could result in early abortions and birth defects in the baby.
Okay.
The next thing that you have to look for before getting pregnant is trying to maintain an optimum weight, because if you are underweight and overweight, both these could result in pregnancy complications.
Okay.
Then we are it's not coming out too much in the open, but we are seeing women and men, both gender, this thing, they are more into alcohol and smoking. This is totally you should totally avoid it in pregnancy, because alcohol can cause a condition called fetal alcohol syndrome. So this could cause a lot of mental and physical defects for the baby. And smoking and alcohol, for either for the woman or for the man, it could cause the defect in the sperm and the egg, resulting in an unhealthy embryo. So that's why this should be totally avoided.
Okay. We have to deal with many more queries related to the care needed to be taken in the first trimester, but we will now be back after a very short break. Stay tuned. Welcome back. You're watching BMC Global Live Al-Hilal Health World. Today's discussion is regarding the first trimester do's and don'ts. So let's move ahead with the discussion. Doctor, another common query is it okay to consume coffee during pregnancy?
Coffee, everybody loves coffee, right? And
yes,
especially in the winters, everybody wants to drink an extra cup of coffee. So yeah, you can take coffee, but coffee contains a lot of caffeine, and that is the reason we tell that you have to restrict it. You don't have to avoid it completely. Those coffee lovers can always have 1 or 2 cups maximum of coffee a day. Okay. Because the reason is that caffeine, it will reduce the blood flow to the baby and can cause early growth retardation, such complications. Okay. So it's best to avoid it to the maximum.
Okay. Doctor, also, is it okay to have pets at home during pregnancy?
Pets, this is again another very difficult issue to handle, because there are so many pet lovers, right?
Yes.
And most of us have a pet at home. But the problem, there are 1 or 2 problems associated with that. One of them is especially associated with cats. Okay. People who are keeping cats as pets, cats, they can transmit a very serious condition called toxoplasmosis. Okay. This is, if this is transmitted, it is usually fecal borne. Okay, so when you're cleaning the litter of the cats and all, it can get transmitted like that to you, and from the mother through the, it can very easily get transmitted to the baby through the placenta. So that could cause serious birth defects and even abortions in the baby. That is why it is very it's quite important to avoid being at very close contact with pets.
Okay. Doctor, can you give us some tips to improve the diet during the first trimester?
During the first trimester, all of us know the first 3 months is like full of nausea, vomiting, bloating, because this all is because of the pregnancy. There is a sudden rise in the pregnancy hormones, so that is affecting the bowel motility. So there will be indigestion, constipation. There are so many issues related with the digestive system at this point. Okay. So that is why it is very important that you keep your food light. Okay, never go by the myth that you have to eat for 2. That is not possible, especially in the first trimester. Okay. You have to go light. Try to eat frequent meals, unlike the normal adults who are eating 2 or 3 meals a day. You can have your meals, munch on something every 3 to 4 hours, but just have it light. Okay. And it's very good, better to avoid the oily, spicy foods. Too much salt should be avoided, too much sugar should be avoided. Okay. And try to avoid all these processed fats, processed cheese, the burgers, fast foods, better avoid, and strict no to colas. Okay. The other thing that we need to include in our diet is definitely fruits and vegetables. Only see to it that it is properly washed and eaten. Okay. Then you have to keep yourself well hydrated, because just like how you face this nausea, vomiting, bloating in pregnancy, there will be a lot of joint aches, body aches in pregnancy. All the time you are having some kind of a back pain or joint ache. So this is all because of a kind of dehydration also that accompanies the first trimester. So keep yourself well hydrated, and I would suggest that it's better not to eat too much food bought from outside, especially meat products. If you want to eat non-vegetarian food, see to it that you are having a home cooked food. That would be more healthy, and it will be tasty also, and it won't be too hard on your stomach.
Doctor, another query is, can we do exercise during the first trimester of pregnancy?
Yes, this is a very, very common doubt for everybody. The first trimester is not for just going and lying down on your couch and taking rest all the time. You have to be up and about. Okay. Even if you feel too much tiredness, you will feel like a lot of lethargy, and you will be feeling very depressed because all the time you have been working, going to office and doing all kinds of activity, and now why are you feeling sleepy all the time? But that is totally normal, because even though you are feeling lethargic because so much is happening inside you, right? Yes. So that is why that's nothing to worry about, but still, as much as possible, it's good to stay active. You have to be physically active whenever possible. So that includes exercise also. You can continue normal exercises. Try to be very mild at it. Okay. You can't do heavy weight lifting. That all should be avoided. But you can do stretching exercises. Daily walking is fine, perfectly fine. Many people have the doubt if they can climb stairs. That is also perfect. But don't take 2-3 steps, jump 2-3 steps at a time. There's a risk of falling. So be very careful whatever you do. Do it lightly, and there is half-hour walking is very good for you, and stretching exercises are also equally good, because as I said, it can help in reducing the backache, the joint aches. Now, when you are trying to stay active, at the same time, whenever you feel very, very tired and lethargic, it's equally important to take rest. On the whole, you have to concentrate on yourself at this time till you feel much better.
Okay. Doctor, we know that vomiting is common during pregnancy, but when should we feel that it is severe vomiting, or when should we approach a doctor?
Yeah, vomiting is also having the same reasons like fatigue, lethargy. The vomiting is also because of the excess pregnancy hormones. Yes. And they are at its maximum in the first trimester. Okay. So that is causing the heartburn, the bloating, and then that will induce vomiting also. this vomiting is also associated with the nausea and the terrible smells. Whatever you smell feels bad to you and gives you the feeling tendency to vomit. So that is when you have to visit a doctor. You have to give a detailed description of whatever you are feeling. The doctor will definitely prescribe some medicines for you, okay, to reduce the vomiting.
Okay.
So you can take it without any fear. Only what is safe, that is what is given. And nowadays there are a lot of natural medicines itself, like you get ginger lozenges, lemon lozenges. These things are having the ginger content in them, and ginger, as you know, helps to reduce the episodes of vomiting. But in spite of all this, in spite of taking all these medicines and trying a lot of natural cure, still a woman may end up vomiting a lot, so much that she is not able to drink even a sip of water. Nothing is there inside her body, and that could result in a very serious condition like acidosis. You are totally depleted of all the vitamins, minerals and all inside your body, and you go in for a complete electrolyte imbalance.
Okay.
So that could result in going in for unconsciousness and even coma. So that is very, very serious. Okay. And when you notice that the medicines are not helping, you are not able to take even an ounce of water into you, you have to visit the doctor again, and you have to be on injectables. The doctor will start injectables for you because you are not able to take anything by mouth. So we have a lot of injections available. We will also start some saline drip and all that, and then once you are much better, your body is back into normal, you will be able to consume these medications.
Doctor, so you are available at Alhilal Moharak branch. So
Right.
are you getting such cases in your hospital?
Yeah, we are getting plenty of such cases, and we are a full-fledged team completely at work at that time, and we have these cases. When these patients come, we get them admitted, get them investigated. For those patients who need the medical services, for the physician, we have a full team available.
Okay.
And also the deliveries, everything is available at Al-Hilal Hospital, Moharak.
Doctor, another query is there any methods to prevent stretch marks after pregnancy?
So stretch marks, as you know, it is because the skin is getting stretched when the pregnancy, the baby is growing bigger, the skin becomes stretched, and the elasticity, the collagen inside will break, and that will result in the stretch marks, right? So it is not totally, you cannot totally avoid it, okay? Whatever you use, creams or medicines, whatever is there, it cannot totally avoid it, because when the baby stretches, the skin will automatically stretch.
Yes.
But what you can do by using creams and certain medications is you can improve the hydration of your skin.
Okay.
You can improve the hydration of your skin so that even if it stretches, there will be, to a great extent, the elasticity will be maintained, and a lot of stretch marks it will come even only a little late in pregnancy, and even once it comes, it will slowly start diminishing. The color and the texture may come back to normal sooner or later if you are regularly hydrating your skin. So it's not just the external improvement, you also need to have plenty of fluids, water, so that the skin is hydrated not only from outside, even from inside.
Doctor, so we dealt through various queries in this episode. So in total, what are the do's and don'ts during the first trimester?
Yeah, so to sum up, one thing is you have to plan the pregnancy first and foremost, and when you know you are planning your pregnancy, you have to start the preconceptional vitamin, that is folic acid. It's our pregnancy vitamin. You have to take 5 milligram per day, that's the recommended dose. You have to take it daily for at least 3 months before pregnancy, and also continue after. Try to maintain a good weight, and make sure that you don't have any kind of unsupervised medications during pregnancy and even when you are planning pregnancy. Eat healthy, exercise well, and stay happy.
Thank you very much, Doctor, for joining with us once again and answering to all our queries. Hope all of you viewers found this episode informative and useful. We will be back again next week, same day, same time, with yet another topic in Health World. Until then, this is Marina signing off. Stay happy, stay healthy. Good night.